Welcome back to the Lift Free and Diet Hard podcast. I'm your host, Andrew Coates. Join me along with industry leaders and friends on a quest to get more people through the gym door and eating and living healthier. Join me where evidence meets empathy while rejecting fitness industry fads and extremism. Let's begin. All right, welcome back to another episode, and I have Dr. Meghan Sak-Ocbina today, doctor of physical therapy, strength coach. I love your media, as I tend to like everybody's media who I have on. It's almost like a precursor for getting guests on here, right? I don't think I've had any guests with shitty media, but it's great to have you on.
Thank you so much for having me. I'm excited to be here.
All right, deep dive, physical therapy world. You have a post. I think half the episode might turn out to be stuff from this. Things your physical therapist probably wishes you knew. The first one is they want to give you great care. The system doesn't always make it possible. Why?
Yes, it's a quite unfortunate situation, but it's similar to most of our healthcare system where it's very insurance ruled, volume driven. I can't think of a single PT that I personally know who got into the profession for any reason other than wanting to help people, and just like having a passion for movement and exercise and all that kind of stuff. So most PTs go into the profession to do that, but then they wind up, most of them in the outpatient setting wind up working in a clinic where volume is the way that they can make money because insurance has continued to drop reimbursements every single year, and new grads are graduating with hundreds of thousands of dollars of debt and they're wanting high salaries. So the only way that clinics can keep their doors open is by, getting more clients in, because again, it's a numbers game. So a lot of PTs are, myself was included, and so many of my friends that I know who are still in the normal, quote unquote, normal setting are kind of disenchanted with the actual like ways that the profession works while they still want to serve people. But it gets challenging to provide good care in that setting.
Well, you mentioned the debt for going to school. I mean, one of the quotes on here was most PTs graduate with six-figure debt. Many don't make six figures. So
Mhm.
how does that play out? I mean, you alluded to it. You're either working within the system that often is broken. You go outside the system. We could talk about the people who don't, the PTs who don't accept insurance, which I think some people
Mhm.
might think, well, that's a bad thing. They don't accept insurance. Maybe you could explain why.
Yeah. So I don't accept insurance. I don't really see many clients in person anymore. But when I went to school, I was an older student. I was 30 when I started school, which is so crazy to think that I was that young because I'm 35 now, almost 36 in less than a month.
Mm,
But I had already had a career as an athletic trainer. I was very, and my husband's a PT, like I was very aware of the fact that I did not want anything to do with an insurance-based setting for a long period of time. And the reason why a lot of PTs that can still get clients without taking insurance, because that tends to be, people as the client, if you don't understand the difference, it makes way more sense to go to the clinic that maybe has like a copay and then your insurance covers the rest. Like that is logical. Like people pay for insurance to use it, obviously.
mm,
However, obviously you end up in that setting with potentially working with a PT one-on-one, most often not. Sometimes seeing a different provider every time, sometimes spending,
mm.
10 minutes with the actual clinician and then the rest of the time with a tech who has a high school, potentially undergraduate degree, but not a doctor of physical therapy. And it's just really difficult to get the attention that a lot of people want. Some people absolutely do not need that one-on-one attention because most people in the United States aren't exercising at all.
Mm.
So, less than optimal care is maybe better than what they could be getting. But if you're someone who really has higher aspirations and is body aware and has higher goals, higher level, then working with someone who doesn't take insurance is really the only way that you can guarantee you get that person's 100% attention. You can see them at the frequency that you want, not the frequency that your insurance allows or that like the clinic requires for getting enough reimbursement. And yeah, it's actually can end up being cheaper because you end up getting right to the source rather
Mm.
than like, having to request more visits and then delay your care for 2 weeks because Evicor put their hand down and said you can't have any more visits, which is a whole other rabbit hole that I'm sure PTs will understand. But
Mm.
there's ways that insurance companies are trying to stop you from getting more money because they don't want to pay more money, right? So
Mm.
they'll be like, yeah, this isn't justified. You don't need any more care. Like you're good. You're back to prior level of function. But when you don't take insurance, you and the client get to decide when you're done. And then you also don't have to be injured to see a PT. Like you could be more proactive or, anticipate a problem that arose in the past could resurface if you up your training volume or whatever. So sometimes it's a matter of, it's essentially, I think of myself as a strength coach with a doctorate and an understanding of more pathological type of situations. So I think a lot of PTs are going the route that they're able to blend more wellness and performance and preventative care rather than just the reactive care that most PTs end up working in.
And you said something critical there, and I've always biased towards if I refer to or platform a physical therapist, DPT, or some of the physical therapists I know are not technically DPTs, but they have to have a strength coach background. So, I mean, of my guests, I mean, there's a long list, but Dr. Michael Mash, Dr. Justin Farnsworth, Dr. Susie Spurlock, Dr. Katie Dabrowski, Adam Meekins, Dr. Sam Spinelli. I mean, that list goes on, and I'm forgetting several great people.
So
But
many,
it's why I keep coming back to you guys, because you guys are fantastic. Or there's some evidence-based strength coaches. I mentioned Alex Sterner off the air. He was a recent guest. He's not a physical therapist, but shit, to me, or Dean Somerset. I recently spoke at an event with Dean. He's been one of my key role models in my career here at Edmonton. I think Dean is probably, he's not a physical therapist, but geez, I think he's better than a lot of the physical therapists floating around in terms of what he's done for rehab and strength.
Yeah.
I
I
mean,
mean, I think obviously as a PT, I don't like to, can I swear on this podcast?
yes, please,
Yeah, I
please.
don't
The
like to
more, the
shit
better.
on a profession, but we're not taught how to excel in school. We're taught how to recognize things that are out of our scope that require
Mhm.
referral or like immediate referral to a different medical provider. And we're taught how to not kill people,
Mm,
and generally how to rehabilitate injuries and recognize them. But just like any profession, just like personal training, you don't get good at personal training by getting whatever the gold standard, personal training certification is. You get good at personal training by working with humans and getting
mm.
good at your craft and recognizing patterns over time. So I think the people, all those people that you just listed, I look up to all of them. And I think that they're all doing a great job of really changing the face of rehab because they are working at a level that is higher than just like the typical, therabands and a massage ice pack, throw it
Mm.
on there. That's that a lot of people picture when they think of PT. And I think that's changing. I hope, but I'm also in kind of a weird echo chamber where it's what I think is happening, but I'm not sure what the general public is actually seeing.
You made the note about not killing people. Are there any, this is frivolous, but maybe not. Are there any documented cases of a physical therapist killing a patient?
I don't think so. I mean, I
Okay.
don't know. I
Ki-
I don't know. I mean,
uh,
there probably are like negligence cases where something happened under someone's watch, but it's
mm.
more like if you recognize, oh, someone has shoulder pain, like, oh, is it a heart attack or is it like a rotator cuff issue? Like it's kind of like that. That is kind of what I was leading towards with that comment.
Because it's not necessarily that frivolous, and not to shit on chiropractors, because I've had some really brilliant ones who also, the brilliant ones tend to also have roots in strength coaching, right? But chiropractors have actually killed people in rare cases, right? Neck adjustments and strokes. So, yeah,
Yeah. Yes. And that's not necessarily because, adjustments are inherently bad. It's because that person in that situation were a bad combination.
totally. Always nuanced. Okay,
Hmm.
we danced around several things, so I think this one's a really good one. PT school focuses heavily on diagnosis and pathology, like you just said. Many PTs learn strength training and programming outside of school. So, what does this result as maybe individually for each client and their therapist, but also system wide? What does this mean?
Yeah, well, I mean, like I said, I was a CSCS, been a CSCS since 2014. So been coaching people for a lot longer than that. So I
Mm,
think that, PT school, you don't have time. Like I was in a hybrid program, so I had 2 years. Most people have 3 years, and you don't have time to cover all the things programming and program design and understanding progression and regression, all that kind of stuff. So it's very much a experience and self experimentation thing that you really get good at, like program design. And most PTs, unfortunately, when they work in a setting where they just burn out because they're seeing so much volume, they don't have
mm,
the bandwidth to get better at that education. I get PTs constantly in my DMs that are asking, where did you learn how to program? And I'm realizing more and more like there's a huge need for like just more courses that are like barbell rehab or PPSC, like things like that, or Justin's course that he started, like all those courses that are blending like those higher level movements, because it's all the same. It's just with rehab, you're starting more towards the floor, and with performance, you're starting more towards the ceiling. And you just have to find the commonalities between those things, meet the person where they're at, and build them up from where they're at.
A quick sponsor break for my current aspiring coach listeners. This episode is brought to you by Train Heroic. If you know me, you know I only work with sponsors I use personally and where I know the people behind the product. Train Heroic is the best online coaching software in the industry. Not only is it a great platform for one-on-one coaching, it's fantastic for group coaching and selling standalone programs. Train Heroic is used by some of my trusted friends, so I switched my online group program here, and my members love it, raving about its ease of use. Having a dedicated app means far greater reliability for my clients and has been by far my best experience with any online coaching software. Train Heroic is a proven and stable industry leader, meaning it isn't going to suddenly disappear. One of the biggest risks in choosing an online coaching software. When you start a free trial today, you'll get 90 days free to experience why I love and trust this platform. You'll get full support from their team, who've been a joy for me to work with. And I trust Train Heroic and the people behind it. Here's how to activate your free 90-day trial. It's 2 important steps. Number 1, go to www.trainheroic.com/liftfree. Step 2, reply to the email you get. It should be trials@trainheroic.com, and let them know I sent you, or go to the links in the show notes. I think this is worth going into because I bias towards, and the list of coaches and DPTs that I said earlier, they almost exclusively think this way, that good rehab is really found in strength training. And you just alluded to, but it's less of a dichotomy and it's more of a spectrum of loads and intensities. Do you want to take that and explain it?
Yeah. I mean, if someone say, for example, all humans need the same patterns to move well and get through their lives. Or, if your goal is hypertrophy, generally you're going to be training a similar pattern. So like squat, hinge, push, pull, all those types of things. If someone is dealing with acute back pain, they may not tolerate, a barbell back squat. Maybe their goal isn't to barbell back squat. I don't really give barbell back squat to a lot of clients. I don't think most people need to, unless their goals are to do that. It's a different rabbit hole that we could go down. But like if someone is having a lot of pain with a certain movement, you want to scale that pattern to something that is not provocative to their issues. And then as they start to respond to that, that's when you can add in more load, more intensity, all that kind of stuff. So it's really just getting whatever the person's body and nervous system are prepared for at the time. You want to introduce it in a way that is digestible, that gets them to trust you, that gets them to trust their body, and then build from there. So if their goal is like over here and they start, and this is not going to be video, it's going to be a podcast, but I'm putting my hands across from each other. If your goal is like way over in like the other room and you're starting in this room, you need to find a way to reverse engineer that ultimate goal. Does that answer your question?
It sure does, but we can take it a little deeper. And one of the things I would love to hear is, because I think intuitively load makes sense. We know that, okay, we've got tissue that's, pissed off, injured, what have you. And finding the sweet spot for a load to be enough of a stimulus to change that tissue. We can come back to that. But you said the nervous system prepared for. I would love to hear what you mean by the nervous system being prepared.
Yes. So pain in general, I'm sure you've had someone talk about pain on this podcast, but
Lots.
Pain in general is an output of your brain. So when your brain does not feel safe with a given scenario, your body will give you a signal that like, this is not a good idea. We need to stop. We need to change. It's a request for change. I think it was, I don't remember who said that, but some famous person said that pain is a request for change. So that's essentially, your nervous system putting on the brakes for you. Whether or not you want to do a movement doesn't matter, because your nervous system will put the brakes on subconsciously, cause pain, or just, guarding, things like that, like limiting your range of motion is another. Tightness is also a symptom of your nervous system holding tension. Obviously, there are also things that accommodate over time. You can get tightness physically, but a lot of the time, initially, it's all just your brain holding tension. So essentially, that's what I mean is you're creating an environment where the person's body feels safe, and that will allow them to move through the motion freely and as desired. So if that's a squat, for example, if they're having pain with a loaded squat, you might want to even if it's like super extreme, like I would start with someone with like quadruped rock back. The
Mm.
squat movement, it's similar things happening at the joints, but it's not loaded. It's really just going through the motions to sort of like trace the outline of what that ultimate movement will be. And then from there, you can kind of tiptoe into things, and different people respond differently. If you have a client who's never trained before in their life, which I'm sure most people listening to this podcast, actually probably a lot of people listening to it work with people like in a normal setting. You might want to approach it in a different way than you would with someone who's super gung-ho and is just dealing with a flare, like a power lifter, high level power lifter who's dealing with a flare up. They're probably not necessarily as averse to trying something new, if that makes sense.
Oh, it sure does. I'm probably going to circle around a little bit because I want to make sure I extract everything out of all this.
Yeah, go
And
for
this
it.
seems, I think I'm asking a similar question just sideways because it's was in the original post I drew from. Just because someone is a PT doesn't mean they understand strength training. That's a specialization. So what exactly does that mean? Because I think a lot of people think, oh, someone is a doctor of physical therapy. That means that they understand the entire spectrum of training.
Yeah, well, what's weird to me is I feel like it's intuitive, but when you do something for so long that you think something's intuitive, but it's actually not at all to the normal person. So
Hmm.
most PTs, they don't understand how to do things with a barbell, but they don't understand how to teach a barbell front squat, but they could teach
Hmm.
someone how to do a sit to stand from a table, because that's like
Hmm.
very common in just lower extremity rehab. So I think most PTs don't understand how to dose load appropriately in a way that is actually salient to the nervous system. So what we were talking about the nervous system before is like turning the alarm off, so like getting your body comfortable. But when you want to actually create adaptation, you have to like it has to make sense for your body to adapt. If you're only doing low level shit all the time, like your body has no reason to change, no reason to build muscle, no reason to get stronger, no reason to progress. So most PTs, what I think they run into in the clinic is that they don't have access to things that they actually can load people. And I'm not saying
Hmm.
be reckless. Like you don't need your 75-year-old grandmother to be doing, 135 on a back squat. Maybe some could, totally. That's totally possible. But that's, heavy for them or fast for them. You want that to be something that you are pushing their body in a safe environment, but you want them to be pushed. You want them to be um your body to be encouraged to adapt. Like I was saying, it all comes down to that, and most PTs do not understand like how to teach people how to bring that intensity in their like strength wise.
I think let's take it a little bit back because I think a lot of people go into physical therapy school with kinesiology backgrounds, right? A degree in
Mm-hmm.
kinesiology. And I work with a lot of personal trainers who have kin degrees, but kinesiology degrees don't necessarily teach strength training and programming extensively either, do they?
I don't know, I don't have one.
Fair.
But
Okay.
I would assume no. I think it's probably just like human movement, um and like biomechanics, things like that. So yeah, they really don't. I mean, I think the only way to really get good at it is to do it yourself, and to, I mean, I have my CSCS, like I said before, but personal training, I'm sure some personal training degrees are good for programming and things like that. But yeah, I mean, the only way really, I can't believe there are PTs out there that are not doing what they preach, because it's just such a great way to learn, and to figure things out. Like I'm constantly tinkering with my own body and my clients and I don't know if you have this experience, but sometimes clients, you'll have them do something but they will interpret it a certain way and you're like, oh, that's actually a great idea. Like that's a separate exercise, so we just created a new one, but that wasn't what I was asking. So yeah, it's just constant experimentation.
How much of all this is the end user? Because I think we could appear to be criticizing the industry and individuals within the industry, right? But how much of this is the person coming in? And of course, we can't necessarily expect that they're going to understand how that all works either. But I think a lot of people, they come out, they've had a car accident, there's something else, a workplace injury. They get fed into the insurance-based system and they think, okay, this physical therapist is going to heal my injuries. They're going to attach me to a machine. They're going to do all these sort of like passive modalities. And then I'm going to come out of here with the tissue healed and I'm good to go. And yeah, their expectations of care and results.
Hmm. Yeah, I mean, I like to tell clients the 50-50 split. It's a relationship. We are the guide and the coach, but they are the ones doing the work. And I think, like you were kind of suggesting there, a lot of people, not a lot of people, but some people who are reluctant to go to physical therapy, because that's a whole nother thing, is sometimes people just want imaging, but their insurance doesn't allow them to get imaging unless they do conservative management with physical therapy for, whatever number of weeks first. So they're kind of there to just like check the box. They're not super invested in the process. So I think educating our patients and our clients is one of the most important things that PTs can do, from a how things work standpoint, and then also how their body works, how pain works. Because I think that the biggest thing that I like to do as a coach and as a PT is empower people. I don't want my clients to need me. I don't want them to team up with me and learn as much as they can from me. But ultimately, I want them to be like, Megan, you have helped me so much. I'm ready to go out on my own. You've taught me how to help myself, how to help my friends, how to help other people. So that's what PTs should be doing, is they should be empowering people. And I think that the insurance industry, unfortunately, and it's not the PTs, it's not always a PT, it's the system doesn't allow for that kind of, just that all-encompassing holistic approach to that team effort.
Imaging. Are people going in, the ones that want the imaging, don't want to do the work? Is part of this the expectation that A, either they're ruling out something, or B, looking for something with the intention of getting the surgery, and they think, oh, the surgery will repair it and then I'm fine? And I certainly hold the opinion that people have the best outcomes post-surgery when they also do traditional strength training, base rehab, physical therapy. Anyway, you're smiling. Good. Talk to me.
Yes. Yes. I mean, I think there's probably multiple reasons why people, get imaging. I'm sure someone on here has talked about how if we were to image everyone, like most people have catastrophic things, or not catastrophic necessarily, but things are going on that should be quote unquote painful, but they're not necessarily. Or people who have zero things on imaging have tons of pain. So it isn't everything. Imaging definitely has value. Surgery definitely has value. But yes, if you go into, it's like pregnancy. If you go into pregnancy week, it's going to be a lot harder to get fitness back after pregnancy. Same thing with the surgery. If you're going into surgery week, it's not like the surgery is going to put you back together, especially if it was an issue that was caused over time by suboptimal mechanics because you were not moving well. Then I think that's certainly, like, I just had a consult call with someone today who had hernia surgery a couple of weeks ago. And a big thing that I was talking about is, yes, the mesh is in there, it's the tissue is repaired, but hernias are generally a pressure management issue. So if we don't fix that, like, that's not to say you will get a hernia again, but it's important to fix that, because they don't just happen out of nowhere. These injuries, unless you were hit by a car or it was in a sports injury that was contact, then a lot of the time it's kind of one of those things where you're like a frog boiling in water. There's all of a sudden something happens, but it was really slow brewing over time.
And you factor in the genetic component, which is often the case with injury stuff, or the load management side, which is something I talk about a lot and everybody we've talked about does. But again, if you're not managing that load, and like I always like to be careful, because I just had Dr. Jordan Feigenbaum on this about the form and injury risk thing. Technique matters, absolutely. And I'm not willing to say there's no relationship between form and injury risk. But oftentimes I think it's poor load management is what manifests as, let's call it, visibly shitty form, even though we can't really define that. And to your point, yes, there's some movement pattern that is creating a force that exceeds the tissue tolerance. Right? So part of that is, okay, let's get the tissue strong. But the other half of it is, all right, let's figure out what tissue is being overworked and can we change the mechanics at that point. So
Yeah, totally. It's like spinal flexion. If you treat your spine like it's made out of glass, it effectively is made of glass. But then you see gymnasts or like other people who are, doing Jefferson curls or things like that, and they're totally fine. Like, your body is so adaptable. There are certainly points where every tissue is going to break, like 100%. And there is such a thing as, form that I would want to fix. But especially with newer clients, like, I am not nearly as much of a stickler about form with someone who is just starting out, as long as it's acceptable, because you can refine it later. There's already enough barriers to fitness. Like, we don't need to create more by being like, you're not allowed to do any kind of squat unless you can do XYZ. So yeah, I think there's definitely a spectrum, like you said. And creating more fear around movement is not ever my goal, but I think awareness of what you're trying to get out of a movement is definitely important.
keep circling back because I had all these things planned and we danced all over them. It's wonderful. But one of your posts does say, if you're reading this, and we'll say listening because most people are, you probably have at least one of these: a rotator cuff tear, disc bulge, degenerative discs, labral tear, meniscal tear, cartilage wear, facet arthritis, spondylitis, tendinopathy. So why is this not necessarily an issue?
Well, because you can, and I don't remember who said this. I think it was Jordan Shallow said you can outfunction structure.
Yeah, absolutely. That's
So
Jordan. Yeah.
you might have structure that's, torn or something going on at the joint, but you can definitely, like, humans are amazing at compensating. Athletes especially are amazing at compensating. So, and again, that's not to say that there isn't a place for surgery, but I think optimizing your function and your body's ability to cope and those tissues tolerance, which is done with training over time.
Hmm.
That was kind of my point with that post is we don't need to be alarmed by anything that we see like on imaging, or if you're diagnosed with something like that's not your identity, and it doesn't have to be painful necessarily. And there are definitely ways to rehab either conservatively or through surgery and post surgery too.
And I don't know the statistics, I should memorize them, but past certain age thresholds, we see a certain percentage of the population is walking around with specifically rotator cuff tears, right?
Mhm.
And I think this also applies to disc bulges, herniations, what have you. And a percentage of those are asymptomatic, and these people don't know it. So your point earlier about imaging, and this is a theme that comes up a lot. It's one of the reasons why I'm very cautious about letting a client go right to imaging first, is because they probably have stuff that's totally asymptomatic that they're
Yes.
functioning fine with, and then all of a sudden what ends up happening, I mean, you probably deal with this a ton. Someone gets image back, they find out that, oh, the big one is degenerative discs. Holy
Mhm.
shit. What does that end up doing for people who hear that language?
Gets in their brain. Yeah. Yeah. Well, that's the thing. You really got to read the room when you're a PT, because there are people, like I was saying earlier about the nervous system, like if you catastrophize something, like that is going to ramp up your like sympathetic nervous system, and that
Hmm.
can contribute to, just kind of a lower threshold for your body's alarm system, which can contribute to more pain. So, and I think it also just creates kind of a I don't know if this is the appropriate use for like nocebo effect, but where you're convinced that you're not going to get better without surgery once you know that something is torn. So I think that imaging can be validating in some ways. Or, I think if someone was dealing with something for a really long time and they feel like it's all in their head and it's not real, then imaging can be helpful. But like I was saying before, pain is your brain. Your brain creates pain. So there are definitely ways that you can, get out of pain without having to go under the knife. But yeah.
Well, I read this list. I'm like, I may have a rotator cuff tear or a
I
labral
do.
tear at my left side.
Mhm.
It's probably one or the other.
Yeah.
I've had Dean Somerset, who's not a PT, and Dr. Sam Spinelli both evaluate that shoulder. Um, I've been told by another doctor of physical therapy I work with, local guy named Jason Dick, he's fantastic, that I probably have a radiculopathy of my cervical spine. So that one flares up and causes some issues sometimes. I mean,
Mhm.
shit happens, right?
Mhm.
And also, and anybody who's a long-time listener, I'll mention this from time to time. I also busted up my right knee. So there's definitely something structurally not 100% there. Tolerate some things, not others. I go about my life. I've
Mhm.
never had any imaging. Part of me is like afraid to, because not only is some goofy shit probably going to come back, I'm probably going to find a few things that I don't even know about, right?
Yeah.
But I just go and lift. All right, I'm going to
Yeah.
circle back. Oh, please go ahead.
Oh, I was just gonna say, and I feel like, I mean, if you're living a full life, you're probably gonna put some wear and tear on your joints. But
Hmm.
the people who aren't doing anything are also putting wear and tear on their joints by not moving around, and they have less capacity. So I think one of those is better than the other.
A quick break from this episode to shout out RP Strength and the RP Hypertrophy app. I have a big confession. I've never used a coach before. I've always auto-regulated my training for decades. But I've known Dr. Mike Isertel and Nick Shaw, the founders of RP, for years. I'll get behind anything they create, including years of reading their books, consuming their media, attending their seminars, and having them as guests on the show. And I've been using the RP Hypertrophy app now for several months. And several things have happened. It forced me to make smaller and more gradual but better increases in weight volume across time, like putting 5-pound plates on each side of a leg press. Like, who does that? Never before. Only 45s. It cut out the jump volume, It made my workouts faster and more efficient. I show up with a plan. I didn't have to think about what to do. I feel more accountable having a log my progress. And I don't skip things because I don't feel like it. If hiring a one-on-one coach isn't for you, using the RP Hypertrophy app is the next best thing to manage your gains and to take the guesswork out of your program. There's a 30-day money-back guarantee, so you can try it risk-free, and if you don't like it, they'll give you your money back. And I've also got you a $50 US dollar discount, so go to rpstrength.com/coats and use the code COATSRP, or go to the link below in the show notes. That's rpstrength.com/coats and use the code COATSRP. I want to circle back to a couple of the things from the original thing because we've gone all over, but I mean, this is hitting all the notes that I wanted. Insurance doesn't pay your PT for giving better care. Now, like we started with, I don't think this means that any PT, and when we keep saying PT, physical therapist, because yes, personal trainer as well, but in this context, physical therapist, thank you.
Mm-hmm.
But I don't think any of them are going in going, well, I want to give shitty care. But again, what happens in reality for the patient?
Yeah, so in reality, the PT, their insurance, the person's insurance is covering their care, but the PT only gets a certain percentage of that. So because of that, in order to make it a salary, they have to see X number of patients a day. So it's almost like it's the middleman that takes a lot of the payment, and it can make things make sense in some ways. So like say post-op, if you need to be seen 3 times a week and have extensive manual therapy, it makes sense because I don't want to say that's not skilled because it is 100% very skilled work, but it's not like fine tuning to get you back to sport. So it doesn't have to be anything like extensive like that. So early on, it does make total sense to use your insurance with things like that, especially because you definitely met your deductible with that $40,000 surgery. But essentially PTs, they're not paid to give you better care. They're paid to, get you in the clinic and hopefully get you out in a certain number of visits, but that doesn't necessarily mean that you got to your goals. Because again, the insurance, I actually don't know the statistics behind like who gets cut off by their insurance before they actually get to their goals and who is able to like see through an entire plan of care that gets them completely to their goals. But some PT clinics, even if they are able to see you for a long enough period of time, that PT doesn't necessarily know how to get you back to like playing high level soccer, or if you're like seeing a pelvic floor PT, like back to lifting, because it's not possible in a lot of those settings because they don't have the equipment or the time to be able to dedicate to that.
And you mentioned earlier in the episode burnout, and this is again one of the points of the post is like, again, if you got a PT who's seeing 12 to 20 patients a day, then I can understand why that would burn people out. And then you have the noose around your neck, so to speak, of the 6-figure debt. So what is that like for the PT who's dealing with that in real time?
Yeah, well, and you're obviously as a PT, you're working with people, which is great, but also most of the people that you're working with are struggling with something that they don't want to be struggling with. So it's a lot of emotional burden, and a lot of documentation because you're in the medical system and insurance requires documentation for reimbursement. So it really it's a lot of heaviness on your brain, like because you're thinking about people's bodies and what's wrong all the time. You think about how to progress them, dealing with how they react to things. If they're super upset one day, like that's really heavy. And then most PTs that I know, like my husband's a PT and he has like hours of paperwork all the time, like at home, unpaid because he's salary, because he doesn't do it when he's with his patients because he's paying attention to his patients and visits. So you're either have your nose in a computer, not really paying attention to what's going on, which is really interesting considering people need eyes on them in order to know if they're moving properly. It's not just the exercise, it's how you do it, right? Or if you don't do your documentation during work, then you have to do it at home, and that takes up time. And most PTs who are working in the outpatient setting, I'm pretty sure most PTs are working 4 10s, so 10-hour days, and then at the end of that 10-hour day, you have more documentation to do. So it just gets to be a lot. And I think, what's really interesting about the reimbursement thing is PT as like an investment for the insurance is actually a lot less costly, and it could help so many more people. But because it's like so low on like their to-do list of like things to deal with, it just gets like shoved under the rug. So reimbursements could be improving, because if we were all to see that the power of good PT is actually like super beneficial, especially now that we have everyone on like GLP-1s and they're all losing muscle mass and probably going to
Mm.
have, you know, a lot more issues, which there's totally a place for those. But I think it's important to be exercising and doing resistance training as well, so you don't just lose muscle. Uh, I think it would just be so easy to just increase reimbursement, and then PTs would have better quality of life. They'd be able to give better care, and it would just be better overall for everyone. But it's just, you know, it's a big cluster. It's hard to get anything done in those like massive industries. So yeah, it's really a shame, to be honest. I know so many good PTs who are just getting really burned out with the profession, or they're shifting into, I mean, some of them are shifting into like doing what I'm doing, either like remote coaching or in person, like cash based. But, you know, depending on where you live, that isn't always necessarily, or your skill set or your like ability to get clients, that can
Mm.
be difficult. Or they're doing like home health, and which is very needed care, but it's, you know, they wanted to work with like orthopedics and do like higher level stuff, but they're, you know, moving into a home health setting because it's more flexible in some ways and it pays better than working in an outpatient setting.
And this is like, again, that big list of people that I fired off earlier. I mean, one of the things that's sort of self-selects about that list is they all generally have fairly well-known brands in the industry. They have larger followings, are very well-respected educators. So it's not like every PT necessarily has access to that pathway. But
Mhm.
that particular group have gone and done exactly what you've done, which is educational resources. It's a lot of online coaching. It's a lot of strength and conditioning stuff. And I think almost like the license from being a doctor of physical therapy or a physical therapist in general just allows for a broader spectrum of treatment, right? Is that fair?
Well, when you're working online with people that are not in your state where you're licensed, you have the scope of a coach with the
Mm.
education of a doctor of physical therapy. So in that setting, it's more that the client understands that you've gone through, you know, 7-ish years of school to get to the point where you are, which, like I was saying before, ironically, I wouldn't say that school was the reason why I'm good at what I do. I would say it's for the work that I put in outside of school. But school is very valuable for sure. And the fact that you can dedicate that time and pass the boards, which are not an easy test, like that says a lot about your work ethic and your diligence and just your dedication to education and understanding. So I think that's the biggest thing when you're working remotely with people. Um, there are certain instances where it is necessary to refer to someone who can be seen in person for someone like a traditional PT setting. But like we've kind of talked about, like there are so many good strength coaches who, I hate to say it, but there are tons of strength coaches who are better at things that PT should be doing than a lot of PTs that I know. And it's not because of the
Mm.
PT, it's because of the system. It's because of the education that we get in school, and then where they end up working, it just doesn't allow for them to grow in the way that they could.
Something I wonder about more so because I don't work in that setting. But given the fact that you have people coming to see you who aren't self-selecting and want to be there. They've been sent there through the insurance model. They were hurt at work, car accidents, I think is kind of the big stereotypical one. And if they don't want to be there, their decorum, is there abuse in that? Because every healthcare worker that I know has dealt with abuse. They're physically assaulted constantly. I have some pretty polarizing thoughts on that whole thing. Maybe I'll share them. We'll see. But um, is I doubt that most physical therapists are seeing regular physical abuse by any stretch of the imagination, but verbal abuse, people just being more than just uncooperative, is that a reality for some of the PTs who are also burnt out, in debt, and just struggling with it all?
I would say probably more likely in like the inpatient setting where you're maybe acute inpatient where you're in the hospital and there's, you know, patients with dementia or like on meds and things like
Mm.
that. I would say that's probably more common. But like in the outpatient setting, it's, you know, it's like you're in a clinic. So people can be, you know, more reluctant to be there and not as bought in to the process because they didn't seek you out specifically. Sometimes they do, for sure.
Mm.
Because I mean, friend and family referrals, those still happen in the outpatient
Mm.
setting. But you know, if they just looked at a list of, or their doctor wrote a, you know, maybe it's a hospital-based PT clinic. So their doctor who's in the same hospital system was like, okay, you got to go here, even though they don't have to go there, they can go wherever they want. Um, Even if it's using insurance, they can go anywhere that takes their insurance. It's not like they're choosing you specifically. So if you know, if you're going to get your hair done I mean, I don't know about men, but like most women will be like, I want to go to this specific person and I want to have this specific thing done because we have a lot of hair. And even though I never do anything with my hair, I still have gone to the same person for 10 plus years because I'm like, why would I go to someone new? This is my hair and it's on my head every day and I care about it. It's not at all the same thing, but I use that analogy a lot with people. I'm like, you wouldn't just go to some random supercuts for your hair unless you don't care
Mm.
about your hair, which is fine. If you don't care about your hair, that's great. There are supercuts hair places that you can go to, which are perfect for some people. But if you have specific goals, then it's a little bit different. So there's a definitely still a place for
Mm.
insurance-based PT, and I think there are definitely good insurance-based clinics and PTs, but I just think there are tons of people who are not thriving in that setting, whether that's a patient or a clinician, and that's why there needs to be like a big shift in either how insurance reimburses, because I think that would solve a lot of problems, or like the ability of a PT to work in a different setting.
I'm smiling at your analogy because I'm not so sure it's not accurate. Because I paused on this, and again, to your point, because you're the one who brought up the comparison, I would imagine that most women, forgive the stereotype, would probably be more discerning about who's cutting their hair than who's doing their physical therapy. Now, we could go broadly to everybody. I would bet, and there's some logic in this too, that most people would be more discerning about their tattoo artist than their physical therapist, right? So,
I would think so, yeah.
but it also speaks to just the fact that people aren't thinking as much on
Yeah.
average about who's taking care of their physical therapy.
Or they're not educated
Hmm.
on it, which I think that's a big thing is like clients are not educated on exercise or their body
Mm.
in general. And that's, it's a systemic cultural problem. But yeah, people don't know the difference between good and bad. They don't know they don't know that it's, not ideal to be seen at the same time as three other patients and to be working with a 21-year-old tech for most of your visit. They don't know that that's not necessarily how things should be done. And I think most PTs actually, I guarantee you all PTs would agree with me that that is not ideal. It's
Mm.
just what needs to happen because, you pay a tech minimum wage and so they help facilitate things on the clinic, but then they end up like doing a lot of the care in some settings, not all of them. Some clinics are using techs appropriately, but a lot of time they're basically a babysitter while the patient goes through their list of exercises that the PT prescribed.
Mm.
So
I mean, charitably, is part of this the fact that the average person who doesn't have much knowledge goes in thinking, well, a physical therapist has all these years of schooling, therefore there's going to be a very high standard of the absolute best care. When you and I both know that there can be a very big difference. There's obviously a big difference between hairstylists and tattoo artists, but I don't think most people view those things in the same light. And I think perhaps that's why people go, well, I don't want to end up with a shitty tattoo artist. I don't want to end up with a shitty personal trainer. I don't want to end up with a shitty hairstylist. But they think that, well, this is a physical therapist, this is a doctor
mm-hmm.
of physical therapist.
Mm-hmm.
They are going to all meet this very high bar. Does that
Yeah,
logically make
yeah,
sense?
I would think so. Because you think about like going to a doctor, like
Mm.
people go to a doctor and there's lots of great doctors, but there's also lots of doctors that are not great. And it's the system, it's not the doctor necessarily.
Mm.
So yeah, I would think that probably just understanding that, oh, this is the PTs, they know what they're doing. That would probably be a reason why someone would just assume that it's going to be good because they just don't know any better. They don't know that there's different like types of PTs. There's different settings that PTs work in. And the reason why most PTs, like I said in my post, the reason why most PTs are taking cash, or the reason why the ones that are taking cash are, is because they got sick of the BS that they have to deal with in the insurance industry and they actually want to help people and like cut straight to the chase rather than, have to work around what insurance allows for and then have the patient think they had a bad experience, but it's because they just didn't have the bandwidth to work with them well in person.
Mm. So I want to bring something back and close the loop too that I think we need a little bit more depth on. There's one of your posts, I'll read it. The problem with most rehab, it never makes it into training. We treat rehab and training like they're separate lanes when they're meant to do the same thing, drive adaptation. And then you further go on to say about what's wrong with most rehab is that it's underloaded, which you mentioned earlier, low load, low nervous system demand, you alluded to earlier, and training is overdosed. Can you tie this all together so that way people have a clear picture of what it should look like?
Yes. So when it comes to rehab, a lot of clinics have, TheraBands, the traditional PT bands, like,
Mm,
your patients or your clients come to you like, oh yeah, I got my band from PT that they cut or whatever. They have that for load. They have the person's body weight, obviously. They have maybe a cable system and then like maybe a 25-pound kettlebell and like dumbbells up to 20 pounds. That's a lot of the time that's kind of the extent of the load. Like I think a lot of PT clinics are getting like barbells and like heavier things now, which is great. But and there are so many things that you could do to challenge someone's body with body weight and those weights. Don't not get me wrong. When you're creative, you can get a lot done. But I think just in general, you're not able to really get them within the physical therapy setting doing something that they would be doing outside of the clinic. So if there's someone who goes to the gym and like usually deadlifts 300 pounds and they injured themselves deadlifting, you probably want to be able to work up to something that kind of resembles that in clinic. Like a 25-pound kettlebell deadlift is not going to cut it for that, and by any stretch of the imagination. So that's what I mean by like it's underdosed, and people are usually discharged before they have actually like been dosed appropriately. And even if they're not like a really strong person, like it's still, I think that there's a lot to be left, there's a lot to be left desired there. And then when it comes to training, I think that good training is dosed appropriately, but then a lot of people are just doing a bunch of like, I call it junk volume, where they're doing a lot of things, but like there's no intention behind those things. And maybe they're
mm,
tired after they train, but they're not really sending a signal. The training is a signal and you recover afterwards. That's where you adapt. And I think a lot of people are kind of missing the mark when it comes to training properly, as far if their goals are, strength or hypertrophy, or even performance, really any goal, unless your goal is just to move, which is also a perfectly fine goal. But I think people think they need more because they don't know what they're looking for. Like they don't know how to get a good intentional stimulus. So what they think is appropriate is just to get tired. And
mm.
I think that that's not really like it will cause some adaptation, but like not probably not the ones that most people are looking for, right? Does that answer your question?
It absolutely does. And I
Okay.
think even though my fault for dancing around with all the questions because you just went into so many places that were so relevant to this conversation, I think it does tie together. Hopefully, everybody listening, message me if you think that I made this too disjointed or if you think it was wonderful. It's all on me, okay? Uh, all the upside, the good, the praise goes for Megan. All the downside is on me.
Thank
One
you.
last thing with the limited time we got. Here's another
Mhm.
quote. I like this one. My client was told by another clinician that because she doesn't do sports, she doesn't need to train power, and you vehemently disagreed.
Yes. And that client has graduated now and she's a badass. Just saying.
Mm.
Yeah, which is really just I can't believe someone said that. I can't believe someone said that in general, regardless of what the person's goal or background was, just because I feel like that's not really the language that I like to use with clients. Because if a client has a certain goal, like it's their goal, it's not your goal. But I also think being a human and she's a mom, like I think that's inherently athletic. And it's not like she needs to be doing anything crazy. She's not like training for the Olympics, but like not falling as an older person is athletic. That takes athleticism, that takes reaction time, that takes speed, strength. And I think that most PTs just think of it as not most PTs. This PT clearly thought of it as like, oh, you don't do sports, so you don't need to be training anything athletic. Like that's just it's I don't know. I like can't even articulate myself because it was so crazy that you said that. But people need to rotate like athletes. People need to be able to move relatively fast like athletes. People need to be powerful like athletes. And that can be relevant to the person and what they're dealing with, what their life requires. But even if you don't do sports, like life requires you to be able to react quickly and exert force fast. So that's that's all I'll say.
I just thought of, and I mean, this is an extreme outlier case, but there's this viral video of, I think, some former Golden Gloves boxer, probably in his 70s. Someone breaks into his home, some young guy, and the elderly boxer tunes the living shit out of the burglar. I love shit like
Nice.
that. Obviously,
Me
there's a
too.
significant skill component there, but that's someone who still has speed, explosiveness, and power.
Yeah, yeah. And it was sad to me that, I mean, I was just glad to be working with her, but it was sad to me that, like, I bet that's I bet that's said to people more often than not, or people just internalize that and think
Mm,
that themselves, when really you can scale anything. And I think that's really what a good PT and a good personal trainer can do, is scale something to the person and then be able to get them like further along if that's what they want or what their life requires. I think that's a huge skill that I think a lot of PTs and just people in my industry are not necessarily able to do. So,
mm. That ties into this one more quote we have time for. Your injury isn't from what you're doing, it's from your not what you're not doing, which speaks to this last piece about not doing power-based stuff. And
mm-hmm.
to me, we know that age is an independent risk factor for injury.
Mm-hmm.
So, but if someone also is not actively maintaining the power, explosiveness, speed, which we
Yeah.
do also know we lose at a faster rate than we lose muscle and bone as we age,
Mm-hmm.
then by that logic, and you mentioned the fall injury risk, which is a big component of this, that we're actually increasing someone's risk of injury long term if we don't train these qualities. Is that true?
Yeah. Yeah. Because if you don't do something, you have no capacity for it. And like, yes, age absolutely is an independent risk factor. And as we get older, our tissue hydration changes, our muscle mass changes, all these things change, wear and tear, all that kind of stuff. But another huge reason why people start to have more issues as they get older is because they stop moving like they did when they were younger. And that's not because they got older, it's because they don't, like, you don't play anymore. We don't like squat all the way down to the floor anymore. We don't rotate anymore. The way we
Mm,
breathe affects like how our rib cage forms and all that kind of stuff. So I think having movement options is a huge component of, I don't want to say injury prevention because you can't prevent injury. You can mitigate the risk of
mm,
injury and you can mitigate the amount of time that you're dealing with an injury, but things happen, but the more capacity you have within your system for all sorts of options, the less likely it is that something silly is going to be the straw that broke the camel's back.
mm. All right, everybody can follow you Instagram. Your media is great. It's
Thank you.
at dr.megsi.dpt. So once again, at dr.megsi.dpt. Anywhere else you want to send them. I know you have programs on Train Heroic. Train
I
Heroic's one of my
do.
sponsors. I have stuff on
I
Train
see
Heroic.
that. Yes.
So love them. Got to hang out with them in Vegas recently. They were one of the sponsors of my friend Aram Gregorian's Real Coaches Summit
Mhm.
event, which I will be speaking at next year. So, guys, he
Awesome.
actually has as of right now, a little shout. He has a limited number of pre-sale tickets. They actually tend to go fast. So, if you're interested, message me. I'll get you that link. But it's a long way out, but it's a great event. So, but anyway, Trainer Heroic, shout out to them. Yep, you got stuff there.
Yep.
What else?
Yes, I do. Instagram's great, honestly. That's the best way to get to me. Just DM me. I answer all my DMs myself.
Amazing. Love this. Evidence-based, nuanced, empathetic, nice humanization of the reality of the person working in your field, that they have great intentions, they're trying to do well, there's major system constraints, and hopefully this is useful for people. Maybe somebody in your world listening is navigating the physical therapy space. And I think, I mean, you're in the US, so a lot of this stuff is US centric, and that stuff's a little different, but it's not necessarily that different in Canada this way. I think the principles overall are generally universal. So I
Mhm.
hope this is a valuable resource to help you navigate it and get the best possible care. Meghan, thank you.
Thank you.